if you're not sleeping well, you also can't do whatever you're doing in life properly. If you do not invest in that sleep hours that are really quality for you, then you're really underserving yourself. One of the things that can tell you early in life, like this person is going to suffer from those things, is also.
They don't allow you to buy hormone-based medications over the counter.
Yeah.
You can buy testosterone. You can't buy progesterone. But why do they allow you to buy melatonin? Hello viewers and listeners. Welcome to another episode of my podcast AdenAress, where I bring on experts to clarify matters about health and wellness. From the statistics, over 70% of the viewers have not subscribed to our channel. I urge you to subscribe and hit the bell icon so that you are notified when we post our next episode. This will help the channel grow and will help us share the knowledge wide. Today my guest is Dr. Khadija Hassan. She's an anesthesiologist. She's the co-founder of SafeSurgical, a non-profitable organization that plans and executes safe surgical procedures that has impact on life with minimal resources available. They basically get the job done. She also uses platforms such as X to advocate for health and living a purposeful life. We have had a Twitter space with her where we discuss about sleep. That's what has initiated this podcast. And that in that life, we promise that we'll have a podcast where we will discuss in depth about sleep. Why are we concerned about sleep and sleep quality? Let's talk about your cardiovascular health, your heart maybe, and your blood vessels. A research which was published in 2019 in the Journal of American College of Cardiology suggested that poor sleep quality increases risk of developing hypertension by 33%. This is even in the absence of sleep conditions such as sleep apnea and insomnia. Another key thing we find out from the research is that sleep causes change in reproductive hormones in women. It decreases the production of progesterone hormone, a hormone that's essential in maintaining normal menstrual cycle, which also supports pregnancy. Dr. Matt Walker, a professor of neuroscience and psychology at the University of California, says that men who sleep less than 5 hours a day have testosterone level that's equal to men who are 10 years older than them. This means that lack of proper sleep or quality sleep reduces a man's age by 10 years. To get more insight, I welcome Dr. Khadija.
Thank you.
To start with, can we define what is sleep?
Yeah. So sleep, personally, I will define as any restoration to body's normal self, which is the normal mechanism of the body to sustain its own, what we call homeostasis. So it's the part of our daily life. It actually covers a third of the human cycle of life. So
a third of your life is basically spent on sleep.
Yeah.
Wow.
So, and it's a part of your life that is supposed to balance with the other aspects of life.
With the other aspects of life. So it was really interesting that I came across this. Still, it was Dr. Matt Walker who said that we stay awake so that we can have a good sleep. You know how important that is. You know, he was trying to emphasize how important sleep is. So he said, we are awake so that we can get a good sleep.
Yeah.
That's how important it is. If it takes, a third of your life.
Yeah. So it's something that worth investing in, because I feel like, because it kind of balances with what you're going throughout your life. So which means basically, if you're not sleeping well, you also can't do whatever you're doing in life properly. So this thing of saying the more I stay awake, for example, the more I will be able to read more information. So the less sleep I have, the more people feel like you're hardworking.
Yeah. People associate not sleeping with productivity and also someone who's having an impactful life. The less you sleep, the less impactful you are to the society and to your own health. At long last, actually, that will catch up with you.
Yeah,
and you will be a burden to the society.
for sure.
Yeah,
Because
you'll
now,
have conditions which we are going to discuss, and that will make you a burden to the society.
yeah, for sure.
So sleep, it's a duration that the brain in relation to our body is there, but we are not aware of the environment. It has stages. What are the different sleep stages?
So, for you to absorb what sleep or sleep stages look like is what brings about sleep in the first place. So, like I said, it's homeostasis of the body. The body itself keeps sleep as a pattern in its own cycle,
Yes.
so that it can maintain your normal body functions. So, what brings about sleep is usually the thing we call fatigue on a normal layman's term. But physiologically, what happens is, as you wake up during the day, there are some hormones that are released and some chemicals that are released, which will lead to eventually you going to sleep at night.
Yes, yes.
So, for you to reach there, first of all, the part of I'm going to sleep, you must have had a full day, first of all.
Yeah.
So you wake up, you get to work, working out. So there's some chemicals like adenosine that it's associated with its accumulation with quality of sleep. So adenosine, with every activity you do, it increases.
Yeah, it increases in your brain.
As you go towards the end of the day. And then we also have two hormones that are interchangeable during the day by perception of light. So the more you are more awake in the morning, the light is taken up in the eye, in the brain. Now it gives you some hormones for the day. Some are given
basically your circadian rhythm.
So what we call now the circadian rhythm, which is going to be important in terms of even the sleep cycle. So if I may start from the sleep cycle, for you to get, first of all, adequate sleep, you must have gone through the 4 stages of sleep. You must have said for you to have finished a cycle of sleep. So the 4 stages in one cycle are the first stage 1 and stage 2. So stage 1 is usually around 5 minutes, and it's you settling down in bed, closing your eyes, and the part of you lacking the awareness of you're about to go to sleep.
So you're zoning out from the environment.
From the environment around you.
So it's what they call N1, I think.
Yeah. So it's around 5 to 10 minutes. The next stage, which is usually now more of what we call non-REM sleep. Yeah. So it lasts around 50 minutes in a 90-minute cycle of sleep. So the 50 minutes now are mostly you reduce your body temperature.
Your body temperature starts going down. Your heart rate starts going down. Your brain activity starts going down.
You are unaware of anything that is happening around you. But the only difference is maybe the fact that there's no dreaming at this stage most of the time. So, and then we go to, after those 50 minutes, we go to stage 3 and 4. Where I will put them together is because the first 2 stages are something you cannot survive without. The later part, which is usually where we call the REM part of sleep, from stage 3 towards 4. 4 is mostly for waking up, towards waking up. So it's usually a short duration, just like stage 1. But now stage 3 is now what we divide into. Some people who will say, I've gotten a proper sleep, which is a full REM, with a full REM cycle of stage 3. Then they can say, I've had a full sleep. Yeah. And that cycle itself lasts around 90 minutes. And once you're done, some people, that's when they turn, or it's just a small brief period of you've slept through a cycle, you're starting a new one,
into the other cycle.
To a new one. So, yeah.
So N2, where we say you have the light sleep, is when you transition from the other stage to the new stage.
To the deep sleep,
Okay. So REM, again, you mentioned something. So REM basically means rapid eye movement. It's a duration where your body has completely gone into sleep. There are only few muscles which are functioning.
Yeah, the basic muscles of functioning, swallowing,
breathing, and all that. And also the one that's there's one that's associated with that is the eyes start moving at that time. So that's when that's how the name rapid eye movement came about. And also to add on that is during REM is when the cognitive function of the memory
it's
basically
created.
happens.
So if I may add, actually, no one used to know the definition of sleep until EEG was discovered. So EEG is the one that is the only thing that can differentiate that you have gone from stage 1, that you're stage 2, and now you're stage 3. And that is what has been used to study. So what I wanted to say is the beautiful part about REM is you really don't need to say that I've had REM or not, because scientifically speaking, the only way to prove, like we said, all of these things is through the EEG. But what is unique about REM cycle of sleep? Why is it important to us? And maybe I could get into that because with every stage of sleep, you get a benefit, which includes now, like stage 1 and 2 is mostly for your personal, like you're going into a rest mode. You physiologically...
at the stage they also say your body is recovering also.
Yes. So it's in a recovery mode. If there's any inflammatory condition going on, this is when you actually produce those hormones for restoration of particularly, especially muscle pains and all those. But the second part of the night, the second stage of the sleep, which is 3 and 4, is mostly for now memory part. So some people now can go into problems saying, I cannot remember my dreams. So everyone goes through dreaming. It can be in any stage, but mostly prominent during the REM cycle of sleep.
This is the time where the cognitive function, the memory, learning, the time that's happening. So when the brain is taking information from short-term memory to a long-term memory, you tend to have a vivid dream or a vivid picture of that memory that's been transferred.
And it gets better. It gets less and less with aging, and there are two things I think. There's aging and maybe drugs. Those are things that can suppress it. But the good thing with REM is now, with any new information you get during the day, especially teenagers and young kids, it's very important. So you'll realize the kids will be sleeping almost like half the day they're sleeping. So, but those kids, any new information, this is the part of the brain where it's taken from a short-term memory to long-term memory. So, for example, if you have a teenage kid, those are things that you need to put into consideration because they do sleep a lot. And they need that
because
sleep.
They're learning a lot. They're in the phase of life where they're learning everything from the environment. Learning, people think it's just, they think learning is just going to school and all that. No, when you're staying here, you're interacting with new people, you're learning. Your brain is adapting to new things, okay? You're getting exposed to new things. So a child coming to the world, they're learning the world basically. So they're learning every minute of their life.
So the more they're sleeping,
the more
they need that sleep.
The more they will retain this information.
And that's the trick. Actually, that's the trick I was trying to tell. Maybe if the parents listening, and you find that your teenager is those people who sleep like most of the day, let them. If they're not doing what they're supposed to do, eventually they will do, I'm sure. But that point of being told as a teenager, like, don't sleep a lot, you can sleep after prayers in the morning. Certain things now, it's something to be aware of.
Another thing, it's very unfortunate. There's one thing I also discourage the society is making children below the age of 7 years going to school early in the morning. 4 a.m. a child is on the street. How unfortunate is that? There is a research that was done in one of the states in USA, and they find out that they added few hours for the student when they can come in from I think 7 to 8 or 8 to 9, and then they realize the grades of the students start improving just because these kids were getting enough rest. But in our society, I don't know what happened. We are trying to circumvent traffic and all that, but who's suffering is the child. You're waking him up at 4 and he's going to school at 5. it's very unfortunate, and it's not helping the child. He will not retain information. Another thing they did is another research that was released concluded that they were scanning information retention after being awake for the last 24 hours, let's say. So and then they realized that from the scans, actually the part of your brain that is meant to receive information, when we are talking, you're telling me something, I have to receive that information. The part that receives that information was least active at that moment, which means this person is not actually receiving this person is not actually receiving information, and let alone storing it.
Yeah, and even logic goes away. It's like you are drunk. When you don't sleep more than 24 hours, you basically become drunk, because the part of the brain that has decision making is altered.
It's impaired.
So, like, you might be driving at a because this has happened to some of us, especially in the medical field. We'll talk about it later as one of the complications of not sleeping. But it can really actually go into a part of you actually cause accidents on the way and all of that. So as I conclude on the cycle of sleep, so now you at least need 3 cycles, which is each at least 90 minutes for you to say, have adequately slept. And it can vary, like we said, from 70 minutes to 90 minutes, but at least you must have had all the stages fully. Because what will happen, like you said, the cycle, if you don't finish the cycle, there are problems. If you don't do 3 cycles, there will be problems. And then also, when are you starting the cycle and when are you finishing? So some routine. People, so the routine of different people are differently. Like you said, there's someone who sleeps at 8 and by 5 a.m., by 4 a.m., they should be awake. So that's their normal cycle. You can't compare yourself with them. There's another person who sleeps from 10 to around 8 or 7:30 a.m. That's another person. Other people are usually called late sleepers, or the ones who sleep past 1, and then they wake up almost 11 there. They do finish their cycles of sleep. It's just that it's messed up. It's towards the end of the night, but they do finish at the end of the day. Yeah. Wow. And that's the most important thing.
What are some of the common sleep disorders and the impact they have on health?
So I think one of the major things most people complain of is insomnia. The other things, so something like sleep apnea. If you have other mental conditions that can affect also sleep disturbances, they need to be talked about as well. So Alzheimer's, Parkinson's, anything about neurological conditions, even seizures if you have epilepsy. And then finally, if it's associated with another mental health illness. There's a neurological condition and then
the other mental health.
So the major problem for most people faces is insomnia. And like you said, definition first. So is it drug-induced? Is it just a partial insomnia? Inability to fall
asleep and
or maintain a sleep. Or maintain a sleep. It can be both sometimes, or sometimes it can be one or the other. So someone will fall asleep but will not maintain the sleep. They can still say, I'm insomnia, I'm having an insomnia.
So another thing I wanted to mention is people say I have insomnia. Do actually people have Do people actually have insomnia, or is it just that they want to associate themselves with insomnia? I mean, if you're sleeping at the wrong time, it doesn't mean when you're awake you have insomnia. I mean, if you have messed up your circadian rhythm and you're sleeping 6 in the morning, it's just that your circadian rhythm has shifted the duration of sleep from the normal time to an abnormal time. It's not that you have insomnia. I get this a lot in my clinic.
Yes.
Where we have patients coming in and they say, I have insomnia. And then you ask them, last night when did you sleep? It tells you, no, the whole night I haven't slept. I slept at 6 in the morning. What time did you wake up? 12 noon. And I'm like, you slept the duration you were supposed to sleep in one complete 24 hours. It's just that you slept at the wrong hours.
Yeah.
So one of the ways you can do to shift that is
let them tell you, first of all, what are the habits, first of all. So you can ask the person what are the habits that why do they think they even have insomnia.
Yeah, we'll come to this, the good habits and the practices you can do.
If I may talk about the insomnia part, so sometimes it can be because of physiologically you are undergoing some stress like academic or you're going financial stress. Sometimes you can get a period. So as long as it's you're going through something else, unless you actually discover what you're going through first of all and deal with it, sometimes you cannot cure that insomnia or you cannot manage that insomnia. So sometimes instead of going and prescribing drugs for people, I don't advise that. First of all, discover why you think you're going through that tough period of not being able to sleep. Rule out any other thing that you could help yourself with, or is it a mental condition you're going through? Like if you are going through periods of anxiety, uncertainty, it can affect. So and also I think the type of mental illness that you have also affects how you manage. So someone can be suffering from what we call manic episode for bipolar, for example. You don't treat the same way as someone who's depressed and not sleeping.
Or someone who's just having anxiety or a stress-related factor like financial
the medications you give are totally different.
Yeah.
So the history is very important, and every doctor, I tell them, do not prescribe first.
Yeah.
Do not try to prescribe whatever you think that will help the patient. Discover, first of all, why do you think they're in that state in the first place?
Personally, I have a principle. I've never prescribed any medication that can induce sleep or maintain sleep. What I do is that I take a thorough history from the patient and I guide them to the specialty they need.
Okay? Exactly.
We have had in this episode, we have had Dr. Nema, who's a psychiatrist and psychotherapist. She's well versed in the treatment of sleep disorders, and I will refer a patient to her. She will better handle it. So if you're a junior doctor or a clinician and you're out there and you encounter someone who's having insomnia, don't give them medication straightforward. Get a good history, consult a specialist, okay? They are phone call away most of the time. Give them a call and refer the patient, if you may, for this patient to get a better treatment, okay?
So the smallest bit I wanted to add is the fact that it's a cycle that has different hormones at different hours. And if you mess up with it, what happens is now you get the side effects of those hormones at the wrong time, at the wrong hour. So
that's a very nice way to put it.
Yeah. So if you like at the normal circadian rhythm is around 3 a.m., your cortisol starts to go up.
Yeah.
It's just a normal cycle. So it starts to go up to around 8 a.m., goes to maximum, and then starts coming down. Yeah. So, and then the melatonin, which is released during the evening hours with the light and all that. So even that gets to be initiated because of the hour of the day.
Because of the cortisol.
Yes. So the cortisol really that's actually going down at some level, and then the light is taken up by the retina, the evening lights. So, and then the same hormones that are circulating are the ones that are, it's like a button switch on for melatonin, natural melatonin. So in the evening, if you don't go outside for a walk or for fresh air, you do not get to have that initiation of melatonin, the natural melatonin on. And then in the morning, if you don't wake up by 8 a.m. and start getting your day, also, you will affect the time the melatonin will be secreted. So it's also a secret because when you release cortisol at the right hour,
you will have melatonin being released at the right hour.
Also, the energy for the day.
12 to 14 hours.
Yeah.
After
the energy
time,
for the day. So the energy for the day is released by that cortisol because of the cascade of hormones that are going to be released afterwards.
Happens. Exactly.
So at the end of the day,
I mentioned this in one of my short videos. Whereby I was saying, if you want to be better active during the day, have a better sleep during the night.
For sure.
Yeah. Set your hormones right so that during the day you're not having fluctuations of these hormones.
Yeah.
Okay.
Sure.
So these things lead to one another, and we'll mention some of them as we go deep into the topic. What are some of the practical tips for improving sleep quality?
So it depends on, like I said, what you're going through as a person. So, and also don't do as I do, do as I say.
I mean, what are general things?
So
that
the
can cut
general
across?
things is, first of all, discover why you think you have a problem. So if you don't have a problem, there are some ways to improve your sleep, or even
The
know
quality
that
of the sleep. You may be sleeping and you don't have a good quality sleep.
of sleep. So one of the few things that I have changed personally in my life is consumption of coffee. Daily
what about
consumption of coffee. So I've it was a passive learning period. One of the podcasts I was listening, that it says that the half-life of coffee itself as a drug is 8 hours. So just like any other drug, it has a half-life. So which is 8 hours. That is the time for the drug to reach its half level at
in the
in the bloodstream for you to have less effect of that drug. So and what coffee does is it competes with adenosine at the receptor level.
We mentioned that adenosine is that chemical in your brain that initiates sleep. How does it initiate sleep? Is it binds to the adenosine receptors, which initiate fatigue in the brain, and that causes you to feel sleep. It initiates sleep.
Yeah.
So if you drink coffee, it's like a parking lot that like adenosine was meant to go to that parking lot. But now coffee goes to that parking lot. So your brain doesn't detect adenosine. So it doesn't detect fatigue. So you end up not initiating sleep.
For someone who used to drink coffee until 3 a.m., it took me a while to really conceptualize that. But the thing is, if you know the science, then you know what to do about it. So now, up to 2 p.m., I don't take anything caffeinated after 2 p.m. It's a personal thing. And then also, like you said, the more you're doing activity during the day, the more you'll feel asleep. So the trick is
the higher the adenosine you will release due to the fatigue.
And then also a few things that have changed is also know your pattern of sleep. So if you are a person for 10 p.m., stick to 10 p.m. So no matter whoever it is, you make sure that at least 3 or 90 minutes before that time,
you're set.
You're trying to set the mood for your sleep. So it's not a one-stop thing. It's a whole complete
so you mentioned
lifestyle change.
Adenosine, routine. I will prefer someone to have an alarm to go to sleep with than having an alarm to wake up with.
For sure. Even the lighting in the room. The lighting in the room. So this bright white blue light, what they call the midday sun, is really good for midday stuff. But at night, it works against you, which is, I think most of our houses, the bright white light, the bright blue light white is the one that's available. And that works against you because your retina, the perception at the retina level says this is still daytime. So it does not have enough melatonin circulating in the system by the time you're going to sleep. So if you want...
same as devices, phones,
laptops, screens, like laptops are highest on the scale. So screens, phones, even reading light. The reading light still affects you as well. The spectrum, I think on the lowest of the spectrum, I can't remember what it was, but it's personally taking a walk by the just before, like 90 minutes before going to sleep. So you change your lightings, given the food you're eating.
Exactly. And the time that you're eating the food. So make sure you are eating your food 2 to 3 hours to your bedtime. Because if your brain is resting and it needs enough blood supply, if the blood is supplying your gastrointestinal tract, so basically your stomach area, you will not be getting enough blood supply to your brain, which means there is not enough resting. Your body is still doing a lot of activities. The other thing you mentioned is coffee. You also mentioned timing. And to add on that also, getting enough sunlight exposure early in the morning.
The evening light and the morning light. Those are the ones that...
So most of the people talk about the evening light. And don't use your phones at night. Don't use light. That is really key. But what people don't mention a lot is, are you getting enough sunlight early in the morning? Because when you get enough sunlight early in the morning is when your cortisol becomes at its highest level.
Peak,
and that initiates as to when melatonin should be released.
Yeah,
Roughly 12 to 14
it's
hours after
around it's a cycle, like we said. One gives into the other one.
Yeah.
So if the other one has delayed, obviously the second one won't be released until the other one picks. So there are few things that you can tune into. That is, I know some people take melatonin.
Yeah.
You don't really need external melatonin.
You don't really need external melatonin. And also to add on that, I will not encourage someone to use melatonin. Think as a doctor, think about this. They don't allow you to buy hormone-based medications over the counter. You can't buy testosterone. You can't buy progesterone. But why do they allow you to buy melatonin, which is also another hormone?
It's affecting your, like you said, the balance of your body.
Yeah.
So if you get too much of melatonin, it means the cortisol has to be released at another level also.
Yeah. But also to add on that, it initiates the negative feedback mechanism.
Exactly.
You take melatonin per oral tablets.
Yeah.
The melatonin in your blood goes up. Your body doesn't know you have taken melatonin. It thinks that the part of your brain that produces melatonin is producing more melatonin.
Yeah.
So what it basically does is it tells that part of the body, don't produce melatonin. We have enough melatonin in the blood.
Exactly.
While in reality, that part wasn't producing enough melatonin. Wasn't producing a lot of melatonin. It's just that you added it by taking it.
It's like you're causing more harm and by treating something. But you're thinking you're treating, but you're actually causing more harm than good.
It's the same thing that happens when you take testosterone, let's say to build muscle. You end up having your testes atrophying, which basically means your testes is becoming small. Why? Because your body detected there's testosterone in the blood which is in excess. They think the testis is producing a lot of testosterone.
Yeah.
Okay? So what it does is it goes and inhibits the production of testosterone.
And that's the problem.
It's the negative
hormonal
feedback mechanism.
Replacement therapy.
So if you can't buy testosterone and you can't buy progesterone, why buy melatonin?
Exactly.
Yeah.
And at the end of the day, every hormone, it works in a negative feedback. So even if it's a thyroid hormone, even if it's a kidney hormone, like whatever hormone you're taking in your body, there's a natural way of maintaining that hormone in a normal level. So everything you take, you'll interrupt any cycle. And all these hormones are usually produced and restored in the same glands. So one affects the other one. It's more of
they feed each other.
Yeah, they feed each other, exactly. Yeah. So I think what I can say is the habits is usually, it's not a one-stop shop. So even your kids, if you're giving them homework to do at 9 p.m., it's not fair to them because you're actually making them more anxious towards the time they need to sleep. And the more hours kids actually sleep, the more intelligent they become the next day.
The more intelligent they become, the more they retain information. So imagine you're giving them assignment at 9. One of the things is that puts you awake early in the morning when you release cortisol hormone. It also makes your adrenal gland to release adrenaline, right?
It prepares you for the day.
Yeah, so which makes you active. So if this child in the evening, if you make them start releasing adrenaline,
some stressful hormones
and some stress hormones, they end up affecting their sleep. They won't have a good quality sleep. In the evening, let's just put it in a simple terms. There are hormones that makes you active, and there are hormones that makes you
down-regulate your system.
Your systems. So you need the hormones that makes you active early in the morning, and you need the hormones that make you your body go into rest late in the evening.
Yeah. So
don't try to.
Yeah, there are natural.
That.
So there are natural things that you can replace in your diet that can improve your sleep. So they said the white melon. The white melon.
White melon, yeah.
I think you've heard about it.
Yeah.
And then was it pumpkins?
I love the white melon.
The white melon, was it pumpkins? If I'm not wrong.
Yeah. I think anything that has good amount of zinc and good amount of magnesium.
As well.
By the way, it's 2 supplements that you can supplement in your diet, be it from food or be it from in form of medications. It's
that all actually helps even with period pain, by the way.
It helps with a lot of stuff. Yeah. Imagine, I was listening to this podcast and this doctor mentions the role of magnesium and how it's related to hypertension. And he mentions one of the elements in the body that causes muscle relaxation is magnesium. So when you have less of magnesium in your system, your muscles are not relaxing enough. On top of that, you have the smooth muscles, the muscles of the arteries. When they're not relaxing enough,
it means you're actually getting into
increases the arterial pressure, which causes hypertension.
I mean,
I personally supplement zinc and magnesium.
Yeah,
and it's
me
something
too.
that I will encourage everyone to do just for the supplementation. Consult your doctor and maybe see how you can get. There are good brands out there.
There's I think a combination of magnesium, zinc, and vitamin D, I think, if I'm not wrong.
There's one called ZMA. I don't want to promote any brand here.
There's no brand promoting, but even the combination. So magnesium, something like magnesium citrate is much more absorbable. And if you're taking other medications, obviously,
you have
to talk to your doctor before
you take any supplement, because some of them they inhibit other drugs. So you need to be discussing that with your doctor. What can you say creates an element of a sleep-friendly environment? What's yours look like?
Okay, so I can describe my room maybe. So blacked out curtains, obviously.
Totally dark.
Yeah, blacked out curtains. So no light can come in, and also no light leaves it. I use red light, bedside lamp, throughout the night. So if anyone actually puts on any other light in our house right now, we all notice it. So I've reached a point of I put on small ones on the corridors, and then the bedroom just becomes the red light. So after 6 p.m., I don't see any white light unless I'm outside, actually.
So when you're sleeping, you also keep off that red light?
Yeah. No. I just keep it in the room because it's less brighter than blue light. So that it's closer to the spectrum of almost the light for the evening, apparently. So what you're running away is the white-blue light.
White-blue, yeah.
So the room as dark as possible. Obviously, the more yellow it is, the better, obviously. The room temperature as well. So if it's too warm, it tends to give you falling asleep harder. But now also, there are people who come from hot areas. So the ambient room temperature depends on what they're used to.
Yeah, what you're physiologically used to.
Yeah.
So you also need the temperature adjusted. Yeah. So I normally try to have the room as cold as possible. So
what do you
anyone
do?
out there,
you can tell us. You actually have you even had an app, right?
Yeah. So what I advise people is if you're reading at night, use light which are dim, that are not facing your eyes. So they should be facing whatever that you're reading. And if you're not reading, better keep off all the light. Yeah. It's better. Okay, sure. So that the
even news after 9 p.m. is unnecessary. Yeah.
I personally consider watching news at all unnecessary. I don't know the last time I've watched news.
For sure. Same here.
So what I say is make the room as dark as possible. Eat 2 to 3 hours before your sleep time. Okay, and make sure your feet are exposed. This is another key thing. Yeah, people cover their feet. And one of the ways our body releases heat is when there's contact of the air and the body. So when you cover your whole body,
I remember that's why some people remove one leg outside.
Yeah. So
to lose some heat.
Yeah. So if you're sleeping, don't cover yourself unless it's extremely cold.
Yeah, for sure.
Okay. It's unnecessary and unproductive for your body, because we mentioned in the first stage of sleep, your body down-regulates everything. Down-regulates the temperature, your heart rate. Okay.
So this is the thing now. So if you want to target calming down now, even the type of movie you're watching towards 7 p.m. really matters.
Really matters, yes. If you watch a movie,
a horror movie, for example,
having a spike of adrenaline, you're going to sleep, and adrenaline will have a negative impact on the pineal gland releasing the melatonin hormone.
Exactly.
So get things that calms you down. There's this thing, There are people who have couples and they end up fighting before their bedtime.
Exactly.
They're from work or something and they fight at home. That also affects your sleep.
Oh, by the way, I think
Significantly.
maybe this is something normal circadian rhythm will give you as a life hack, I guess. Your libido is mostly highest in the morning, around 6 to 8 a.m., and from at night from 10 p.m. to midnight. That's when your libido is highest.
Yeah.
Maybe you can use it.
You can use
for
that to your
future reference.
So
it was one of the interesting facts I actually read about the whole circadian rhythm. It's really interesting, by the way. There's so many other hormones that affect as well.
They out there are information that are meant for the layman also. You can check it out in form of pictures that show the whole circadian rhythm and what happens at every part of the day.
And learn to trick your body into it.
Yeah, I mean, make sure what you're doing are in line with what your circadian rhythm is doing.
Yeah.
So, what is the connection between sleep and physical health?
So, like I said, you know those people who say, "Oh, I can't sleep like more than 6 hours," especially men. Sorry to say, some men will be like, "Oh, what do you mean? What are you doing sleeping at 4? Like waking up by 5 a.m. and you don't go back to sleep?" Yes, but also, are you having an adequate sleep? Is it healthy sleep? Are you finishing all your cycles? And also, if you have any substance abuse problems, it will affect eventually in your cognition, intelligence, and all that. But the physical health part is, I will say this, for patients with chronic pain, it's hard for them to sleep at night. So this is the thing. It's a vicious cycle. As someone who suffered from chronic back pain, so the thing was, if the pain is too much, you won't be able to sleep. But also that increases your cortisol because you're stressed. You're really stressed. The cortisol does not really help with pain management in the grand scheme of things. So you find that your chronic pain becomes worse because you didn't sleep, but your lack of sleep becomes worse again because of the high levels of stressful hormones in your body. So it does not say necessarily for you to be physically healthy, you must sleep. But what type of sleep you're having also affects the kind of healthy sleep, healthy body you have during the day.
Yeah.
So I would say,
the people who are lifting and people who are out there seeking to have, to build their muscles, sleep is one of the key main things. You may have your diet right, you may have your workout right, but you're not giving your body enough time to recover.
Exactly.
Okay.
Your muscles,
we mentioned the first two stages of sleep. The non-REM part of sleep is actually for body relaxation and restoration and repair. And something key to mention here is that I will be discussing this with maybe an oncologist. Is during this the non-REM sleep, the non-REM part of sleep, the N1 and N2 and N3 also, is the time where your body produces what's called the natural killer cells. These are type of white blood cells that these are type of immune response cells that fights against things that are introduced into your body, be it growth, be it things that you have been consuming. So sleep also helps physically in that manner.
So I would also say, physically speaking, you can only physiologically stay awake up to 6 days. But what is interesting is you can survive without eating for longer than that, like more than 30 days without eating. But for sleep, it's only 6 days.
It's
before you go crazy and psychotic, it's 6 days. So what I will say is, your physical health, for it to be optimum, you need adequate sleep. First, you rule out the adequate sleep. So if you have issues after that, then you start, like any other thing, by the way, when you have depression, when you have anxiety, when you have any physical ailment, that's why the first thing someone will ask you is, yes, are you able to sleep? So you are depressed, yes. But no, if it's not giving you sleep or it's giving you too much sleep, that's what the person comes for, actually, most of the time.
Yeah, that's really interesting. What are some common myths about sleep? This is a really hard question. This came from one of our viewers who follows me on Instagram. I posted, I'm having a doctor and we'll talk about sleep. What are some of the questions you want to ask? Someone said they want to know the common myths about sleep.
Maybe misconceptions. What we can say, not myths, but misconceptions. The more you sleep, the more you're lazy. Not really. So sometimes you're actually sick. Literally, you're sick. Like we'll discuss at some point, I think, types of disorders with sleep and all that. So it's not just insomnia. So someone can have hypersomnia, which is a symptom of major depression with depressive state. You can have depression with no sleep at all. You understand? That's different also. Mania, the sleep in mania is you don't even see the need for sleep. So that person, you first treat the mania before even you treat them for lack of sleep. So someone like anxiety disorders. If you have an anxiety disorder, not just you're anxious, but an anxiety disorder, apart from giving you the medications like benzos, I will actually tell you, go behavioral changes,
do this and that.
Do this, do that. Like, you don't just tackle when you're not sleeping only. So everything is correlated. You can say this person is lazy. The myth is that this person is lazy and they're sleeping, they love sleep, or they're too lazy. But sometimes it's because of undiagnosed circumstances that are put in there. Maybe that I can add on that as a misconception.
Yeah. How can I, another person asked, how can I manage insomnia and improve my sleep quality? We mentioned most of the things, but the key thing I'll mention to respond to this is, what do you mean by insomnia? Has it been diagnosed by a doctor?
Go to the doctor. Like you said, sometimes you're sleeping during the whole day. That does not count as insomnia. And we'll talk about it in behavioral changes, what you need to do to get treated with insomnia. So you can divide them into two, I think, the pharmacological and non-pharmacological. I don't advise on pharmacological because most of the time you don't know what is the underlying condition and you might be just plastering on something. But the non-pharmacological things are things that have shown like they actually give you a better form of sleep. So, like you said, behavioral changes first. Are you someone sleeping during the day? So you need to cut that out. If you take naps or several naps, you also need to cut that out. Even like at night towards the time for sleeping, you have to cut down things for you to actually know whether it's just because of a physiological condition. So give yourself the optimum need for sleep. So teas, you can take even teas. Some people take teas like, what do you call it? Peppermint. There are some that are very relaxing, by the way. I was even hearing
apparently also the nicotine in tea can make you not to sleep. I know.
No,
friends.
Not all teas. So that's why even the tea, the purple thing, what do you call? You can even put incense in your room to help you going back to sleep. So the peppermint, there's that purple flower. What do you call it?
I don't really recall. I'm trying to picture it.
Lavender, yes. If you put lavender,
a man who doesn't know that. That's me.
It's acceptable because I don't think most men use those things. But as a woman, even taking a warm shower towards sleep can really improve your quality of sleep.
Can really improve your sleep. You actually relax more when you have a warm shower than cold shower. Cold shower basically makes you active.
In the morning,
cold showers in the morning. Causes a peak in adrenaline, which makes you more active and
just
more
before you go to gym, just go into the shower with cold water. You'll actually get that adrenaline for the next 1 hour.
If you want more relaxation, take a cold shower. I mean warm shower.
For sure. The muscles and all that.
Are there specific strategies for improving sleep when dealing with shift works? Talk to doctors now. Talk to your colleagues.
We are
Talk to
toxic.
us.
We are really toxic. So we preach wine. What's it called? We preach water, but we drink wine.
Yeah.
I think doctors, I can honestly say, if you do not look at yourself, and
You cannot look after other people.
Yeah. First
you
of
cannot
all,
take care of someone
and
if you yourself are having problems, or you're in the path of having problems.
So the problem with now residency or high intensity areas, it can even change your personality eventually.
Ah, interesting.
What I felt was when you really don't have powers of the time you're sleeping, you tend to sleep everywhere you are. And it's not actually healthy. There are some people. So, there's some people in the school who are bragging like, me, I can sleep anywhere I want. But it's not really because it's just because you are not getting enough sleep at night.
Yeah,
That's it.
you always have a peak of adenosine in your brain.
So
that
you
are binding to the receptors
can black
and you're
out
feeling sleepy.
anywhere. Those are the most unhealthy people, by the way. If you can black out anywhere, it means you really have a problem you're dealing with. And like you said, sleep problems are so many. So hypersomnolence, or if you have something we call narcolepsy, it's actually a medical condition.
Yeah.
So are you a person who is really suffering, or is it because you actually have bad hygiene of sleep? So what I usually say is something like residency, it's just a matter of time.
So it's two things
do
here.
Not let
it's either you're having a medical condition you're dealing with, or you're over fatigued.
Yeah.
If you can black out anywhere, broad daylight.
I know some people who used to just brag about it in school. I'm just putting it out there.
I was, at some point what I remember is I had two friends and they really helped me through school. So what they used to do is that in exam room, they have to check if I'm there. Otherwise I'd be sleeping.
Also now you're remembering yourself. By the way, the most interesting things I think happen to us when we're in school, because some of them dream badly. You've seen that before exams. People have nightmares because of the imbalance in the brain. That's it, by the way. You're not getting adequate 90 minutes sleep cycle. And you need to get at least 2 or 3 for you to say you've had a restorative sleep. Adequate restorative sleep. I think like...
Other than insomnia, what are the other medical or even conditions that someone can have with sleep?
So I want to talk about the obstructive sleep apnea to be... So it's a structural problem most of the time. So it can...
What is obstructive apnea?
So it's because of your airways blocking, you get to a point in your sleep where you're no longer breathing, which is normally when you really can't control your normal.
Is this what causes snoring?
Yes, it's airway obstruction most of the time. So in children, mostly it's associated with adenotonsils, hypertrophy.
Polyps.
Or if they actually have a large tongue that falls down so slow once they go to sleep. So for adults, I think for men, I think normally it's because of the tongue falling down, the neck circumference. For women, if you have
weight plays a key role.
So this is the vicious cycle where I really wanted to speak about. So OSA brings about all of these other problems, but like obesity, hypertension, diabetes. One of the things that can tell you early in life, like this person is going to suffer from those things, is OSA actually. And there's a definition when it comes to children and when it comes to adults. So for children, mostly, you don't ask questions like, what's the next circumference? There's a scoring system. It's a whole scoring system. So for children, normally, you just ask the parent, like, how are they when they are sleeping? So some people actually record videos, and you can actually see the baby breathes until they complete obstruction, and then they sugar. Unlike in adults, sometimes it's complete obstruction. Like even when they lie down flat, it just obstructs.
One of the ways adults deal with it, I've seen, is they change position.
They change positions. Some people, it's so extreme that they have to have what we call the CPAP machine.
Yeah, CPAP, yeah.
So I wanted to really talk about this because it does affect your health as a person, as a child. If you're going through that obstructive sleep apnea chronically, it interferes with your learning. So during the day, the child is not fully awake. They are not concentrating on anything. They might be suffering from a small case of narcolepsy. Their learning becomes difficult. Like I said, memory becomes more difficult. The child just becomes obtuse.
Every condition associated with the lack of quality sleep basically happens to that person.
Yes,
Because
and then
they are not
including
enough
heart and lung changes, including lung and heart changes. So because of that obstruction, the child can actually go into the lungs hypertrophying so that you can accommodate more blood. These children actually get used to low levels of oxygen.
Low levels of oxygen.
Yeah.
So you form adaptation.
And then that's when now it comes in with cardiac changes. So the heart becomes so big to accommodate that little oxygen that is running through the system to reach everywhere. The worst is the fact that it can really make that child lag behind in life.
So
and it's something that you can do something, and it's something you can do something about before even it becomes to. It's progressive. That means the bigger the child becomes, the more the hypertrophy increases sometimes,
the more the adaptive
and the changes happen. So if they need to do surgery,
what can they do, the parents?
So if you notice that the child has gone into obstructive sleep apnea periods, because it increases, so even the period for the sleep apnea increases with time. So before even you get to reach the physiological and anatomical changes, I would advise, first of all, get to the doctor, let them be diagnosed, then the appropriate surgery can be done. So for some adult male, most of the time males suffer from it because of the tongue, the large tongue proportional to the mouth. There are some procedures that the ENT surgeon can do. It's painful procedures, but at least the quality of sleep will be improved.
And then every important thing you can get from sleep, you will get it. Than missing it.
Yeah. So now also usually leads to obesity because of the hormonal changes that you have chronically running cortisol in the system. All of those lead to obesity. And obesity now brings other things like hypertension, the chronic, like you said, when you have a quality restorative sleeps, even your immunity is stronger. The natural killer cells, those antioxidants are all produced on time. So that means risk of blood pressure or any cardiovascular diseases are increased as well. Yeah. So it's a, let's say, really a vicious cycle.
Really insightful. Yeah. And it all comes down to the thinking of you have to improve the quality of your sleep for you to improve all these other conditions. There is a correlation between sleep and mental health we haven't mentioned.
Yeah. So it can predispose you. If you are genetically predisposed already and you're going through a difficult time in your life and you're not having adequate sleep, that becomes a recipe for you
to get depression,
a psychotic episode, for example. And I'm not saying it's unique to people. Some people, you become under so much stress until you go into a psychotic breakdown, just because you have a prolonged fatigue period that affects your nutrition, your immunity. So even malnutrition, you become actually malnourished because of the chronic fatigue. And it reaches a point your body now shuts down.
Your body basically gives up at one point.
Yeah. Most people usually say they go into a psychotic episode, but I feel like it's something that you can even prevent before even it happens.
Before it reaches to that level. So it causes depression, it leads to anxiety. Basically, it exacerbates anything that may have happened within your body. Another key thing to mention is seasonal affective disorder.
Yeah.
which is also common with
So
sleep.
especially in the people with who
With the
live
West.
in the most
Yeah,
tropics,
yeah.
I mean outside the tropics,
Yeah.
they get extreme weather changes.
Extreme weather
especially
changes
this,
and also shifting of the day,
yeah,
what they call daylight
saving time.
Yeah.
Imagine there are some people who are in 24-hour darkness.
And another key thing to mention while on that is that they realize that a certain part that's affected by the daylight saving time is cardiovascular conditions such as stroke increases during those time drastically.
Yeah.
Imagine that
The risk factors are actually like quite up there.
Yeah.
So not just stroke, by the way. I feel like even behavioral changes, you become more irritable. You become you start having
Impulsive.
personality disorders because of lack of sleep. By the way,
Because
it's
of
possible.
lack of quality of sleep,
Irritability, your thinking becomes challenged because you are not in a logical thinking manner. Because most of the logic works with restorative sleep. Memory problems, especially if you're in school. I would say anyone with obesity already, there are a lot of things working against you. So the only way to restore your normal habit is maybe if you actually normalize your sleep, then you can avoid those
other precursors
to hypertension and diabetes. I really insist on that because nowadays it's becoming very prominent.
Very prominent.
And it's very comfortable.
There's this thing I think about. You see, a female patient came to the hospital and she talks about her having an irregular menstrual cycle.
Exactly.
And we never ask her about sleep.
And it's a very important
You just want to find out which hormone is low or which hormone is high. Either control it or supplement it. While you didn't even realize, is this person having enough sleep?
Fertility, by
the way. Yeah.
Because all these hormones are all controlled and produced in a circular manner and the same parts of the brain that I initiated. So if there's any in one of the circles, if there's any hormone that is affected, everything else becomes affected.
Yeah. One of the intriguing things I found out recently is that sleep affects all the systems. There's no system that's not affected by lack of quality sleep.
From immunity,
cardiovascular, hormonal, endocrine thing.
I would honestly say
even musculoskeleton,
even
your
chronic
bones,
pain becomes worse.
Osteoporosis is related with
because
sleep.
of the hormones that are released during the stressful stage of not sleeping for a long time. What I can say is honestly, if you do not invest in your personal as a person, if you do not invest in that sleep hours that are really quality for you, then you're really underserving yourself as a person who wants to be successful in life, generally speaking.
Exactly.
Yeah.
So what are the key takeaway points from this podcast? We just talked about a lot of things. If we can narrow it down into points, what can you say?
So awareness of what sleep is to you, first of all. Do you have a quality sleep or not? And if not, what can you do about it from all the things that we've talked about? What do you want to improve on it as a person? And also, if you're going through a sleep issue, from even nightmares, by the way, there's so many things we haven't discussed because there's no
enough time.
The disorders are so many, but all I can say is, first of all, if you have a disorganized sleep pattern, it disorganizes every other aspect of your life.
Yeah.
So get that right first for you to have an early and a quality start to life generally.
Yeah. So the key things I've learned from you in this podcast is make sure you're having a good sleep duration. That is number one. Number two, routine is better than anything else.
Yeah.
Make sure you have the right
routine.
We mentioned that have a time to go to sleep, not a time to wake up. That will do justice to your body. Number three, eating before sleep. It should be 2 to 3 hours prior to your sleep time. This will prevent conditions like gastritis, gastric esophageal reflux disease, GERD,
even digestive issues.
Issues.
when you mess up with the time for digestion with sleep, that's what happens. You
Yeah.
dysregulate your hormonal response.
So get enough sunlight exposure early in the morning. Reduce exposure to blue light during the night.
During the night. Go for warmer colors in the house, in a big house, for example. Warmer colors, I mean, like the spectrum of not white and blue. So if you can go online, you can check what are the spectrums of light.
This has been really interesting episode that we had with Dr. Khadija. We'll have her again.
New.
I hope you have learned something new, and make sure you follow our podcast both through YouTube, and we are posting it on Spotify. Follow us and kindly share this. Thank you so much. Thank you for tuning in.